Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Multiple myeloma. Introduction. Multiple myeloma is a type of cancer that affects white blood cells. These cells are part of the immune system, which helps protect the body from infection and disease. This patient education program will help you understand multiple myeloma and its treatment options. Cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing without normal controls, causing an abnormal growth called a tumor. If a tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are almost never life-threatening. If the tumor invades and destroys nearby cells, it is called a malignant tumor or cancer. Cancer can sometimes be life-threatening. Cancerous cells sometimes spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer treatments are used to kill or control abnormally growing cancerous cells. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the pancreas will always be called pancreatic cancer, even if it spreads to other places in the body. Although healthcare providers can locate where a cancer started, the cause of cancer in an individual patient cannot always be identified. Cells contain hereditary or genetic materials called chromosomes. Chromosomes control the growth of cells. Cancer always arises from changes that happen in the chromosomes. When the chromosomes in a cell become abnormal, the cell can lose the ability to control its growth. Sudden changes in genetic material can happen for a variety of reasons. These changes are sometimes inherited. Changes in chromosomes may also happen as a result of exposure to infections, drugs, tobacco, chemicals, or other factors. In the case of skin cancer, sunlight causes damage to the chromosomes leading to cancer. Multiple myeloma. Multiple myeloma is a type of cancer that affects certain white blood cells called plasma cells. Plasma cells and other white blood cells are part of the immune system, which helps protect the body from infection and disease. Excessive plasma cells may eventually mass together to form a tumor or tumors in various sites in the body, especially the bone marrow. All white blood cells begin their development in bone marrow, the soft spongy tissue that fills the center of most bones. Certain white blood cells leave the bone marrow and finish growing in other parts of the body. Some develop into plasma cells when the immune system needs them to fight infection and disease. Plasma cells produce antibodies, which are special chemicals that move through the bloodstream to help the body get rid of harmful substances. Each type of plasma cell responds to only one specific substance by making a large number of antibodies that find and fight that one substance. Since the body has many types of plasma cells, it can defend the body against many types of bacteria and diseases. When cancer involves plasma cells, the body keeps producing more and more of these cells. The unneeded plasma cells, all abnormal and exactly alike, are called myeloma cells. Myeloma cells tend to collect in bone marrow and in the hard outer part of bones. Sometimes they collect in only one bone and form a single mass or tumor called a plasmacytoma. In most cases, myeloma cells collect in many bones, often forming many tumors and causing other problems. When this happens, the disease is called multiple myeloma. Since people with multiple myeloma have an abnormally large number of identical plasma cells, they also have too much of one type of antibody. These myeloma cells and antibodies can cause a number of serious medical problems. As myeloma cells increase in number, they damage and weaken bones, causing pain and sometimes fractures. Bone pain can make it difficult for patients to move. When bones become damaged, calcium is released into the blood. This may lead to hypercalcemia, or too much calcium in the blood. Hypercalcemia can cause loss of appetite, nausea, thirst, fatigue, muscle weakness, restlessness, confusion. Myeloma cells prevent bone marrow from making normal plasma cells and other white blood cells that are important to the immune system. When this happens, the patient may not be able to fight infection and disease. Myeloma cancer cells can also prevent new red blood cells from growing. Red blood cells carry oxygen, and without enough of them, a person has anemia. Patients with anemia may feel unusually tired or weak because they lack the normal oxygen-carrying capacity of the blood. Multiple myeloma patients can have serious problems with their kidneys. Extra antibodies and calcium can prevent the kidneys from filtering and cleaning the blood correctly. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms and causes. Symptoms of multiple myeloma depend on how advanced the disease is. In the earliest stage of the disease, there may be no symptoms. When symptoms of multiple myeloma happen, they may include bone pain, often in the back or ribs, broken bones, weakness and fatigue, weight loss, repeated infections. When myeloma is in advanced stages, symptoms may include nausea, vomiting, constipation, problems with urination, weakness or numbness in the legs. Currently, there is no known cause of multiple myeloma. It is not contagious, and most multiple myeloma patients are between 50 and 70 years old. By studying large numbers of people all over the world, researchers have found certain risk factors that increase a person's risk of getting multiple myeloma. Some of the risk factors include age, ethnicity. Multiple myeloma is twice as common in black people as in white people. High-energy radiation, such as atomic radiation. A family member who has multiple myeloma in very rare cases. Long exposure to chemicals, such as benzene. Weight. People who are overweight are more likely to have multiple myeloma. Previous diseases, such as diseases in plasma cells. Diagnosis. Multiple myeloma may be found as part of a routine physical exam before patients have symptoms. The healthcare provider asks about personal and family medical history when performing a complete physical exam. The healthcare provider may order a number of tests to determine the cause of symptoms. If a patient has bone pain, X-rays can show whether any bones are damaged or broken. Samples of the patient's blood and urine are checked to find out whether they contain high levels of antibody proteins called M proteins. These are the chemicals made by cancerous plasma cells. The healthcare provider may take a sample of bone marrow to determine if it contains cancerous cells. A sample is taken by doing either a bone marrow aspiration or a bone marrow biopsy. A pathologist examines the sample under a microscope to see whether myeloma cells are present. For a bone marrow aspiration, the healthcare provider inserts a needle into the hip bone or breastbone to withdraw a sample of fluid and cells from the bone marrow. For a bone marrow biopsy, the healthcare provider uses a needle to withdraw a sample of solid tissue from the marrow. Before the sample is taken, local anesthesia is used to numb the area. This helps to reduce the pain. To plan a patient's treatment, the healthcare provider must know what stage the myeloma is in. Staging is a careful attempt to find out what parts of the body are affected by the cancer. Results of the patient's exam Blood tests and bone marrow tests help the healthcare provider determine what stage the disease is in. Staging usually involves a series of X-rays to determine the number and size of tumors in the bones. In some cases, the patient must have MRIs done if more detailed views of the bones are needed. Treatment. Treatment for multiple myeloma depends on what stage the cancer is in and the patient's symptoms. The healthcare provider also considers the person's age and general health. Plasmacytoma and multiple myeloma are very hard to cure. Although patients who have a plasmacytoma may be free of symptoms for a long time after treatment, many eventually develop multiple myeloma. For patients with multiple myeloma, treatment can improve the quality of their life by controlling the symptoms and complications of the disease. People who have multiple myeloma but no symptoms usually do not receive treatment because the risks and side effects may outweigh the benefits, but treatment begins when symptoms appear. Treatment for multiple myeloma could include targeted therapy, immunotherapy, chemotherapy, radiation therapy, or stem cell transplantation. Targeted therapy involves using medication that targets and destroys cancer cells without harming normal cells. It could be given as a pill or as an injection. Ask your healthcare provider if targeted therapy is right for you. Immunotherapy or biological therapy fights cancer by boosting your body's immune system. It may help your body kill cancer cells, slow down their growth, or prevent them from spreading. Like any cancer treatment, immunotherapy can have risks and side effects. Immunotherapy may not be right for all cancer patients. Some types of immunotherapy are still being studied in clinical trials. Ask your healthcare provider if immunotherapy can help with your cancer. Chemotherapy is the use of drugs to treat cancer. Radiation therapy uses high-energy rays to damage cancer cells and stop them from growing. Chemotherapy and radiation therapy are very powerful treatments. They can help patients feel better by relieving symptoms such as pain. But it is hard to limit therapies so that only cancer cells are destroyed. Healthy cells may be affected too. Since healthy cells may also be damaged, treatment can cause side effects. Side effects of cancer treatment vary from person to person. They may even be different from one treatment to the next. Stem cells are the basic cells in the bone marrow. They form all the blood cells. In advanced cases of multiple myeloma, replacing the bone marrow and its stem cells with new healthy stem cells becomes necessary. This is known as stem cell transplantation. The patient's myeloma-producing bone marrow is destroyed by high doses of chemotherapy. It is then replaced by healthy stem cells. Patients who have a stem cell transplant usually stay in the hospital for several weeks. Until the transplanted stem cells begin to produce enough white blood cells, patients must be carefully protected from infection. Besides limiting cancer growth, treatment for multiple myeloma reduces symptoms such as pain caused by bone damage or by tumors pressing on nerves. Pain medicine, a back or neck brace, and relaxation techniques are usually suggested to help relieve pain. Additional treatment for multiple myeloma includes antibiotics to treat infections, medications to control calcium levels in the blood, dialysis or plasmapheresis to clean the blood, blood transfusions to treat anemia, operations for broken bones. It is important for the patient to exercise and be active to reduce calcium loss. Drink a lot of fluid every day to help the kidneys clean blood. Stay out of crowds and away from people with colds or other infectious diseases. Eat well to counteract loss of appetite, nausea, and vomiting. Many clinical trials are available for patients. Clinical trials are experiments designed to help find out whether a new treatment is safe and effective. These treatments are thought to be at least as good as regular treatments. If you are interested in clinical trial treatments, you should ask your healthcare provider. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Multiple myeloma is a type of cancer that affects certain white blood cells called plasma cells. Multiple myeloma is very hard to cure, but several treatment options are available to improve the quality of life by controlling the symptoms and complications of the disease. Healthcare providers diagnose multiple myeloma using lab tests, imaging tests, and a bone marrow biopsy. Your treatment depends on how advanced the disease is and whether you have symptoms. If you have no symptoms, you may not need treatment right away. If you have symptoms, you may have chemotherapy, stem cell transplantation, radiation, immunotherapy, or targeted therapy. Thank you for using Explain.